Hello to everyone. In this video lecture, we are going to discuss blue baby syndrome or blue babies, which also known as cyanosis. In this condition, usually baby's skin, especially of infants, become bluish or purplish in color. This condition is due to the lack of oxygen or poor oxygenation to the tissues of the body. This condition may be genetic or may be defects in the heart, and it can be treated by oxygenation, proper oxygenation of the blood. So first of all, we are going to look at the symptoms of blue baby syndrome. So the main symptom is the bluish skin, cyanosis of the skin of the infant. And other symptoms include failure to thrive. Such babies which have cyanosis may be died in their early age. So that is one of the major symptom of this disease. Lethargy, which is another symptom, because there is a poor oxygenation to the body tissue, body muscles, and the baby is going to feel lethargic and is not gonna do physical activities as normal babies do. Rapid heart rate, seizures, shortness of breath, bluish color of skin, and feeding issues. Because there is a shortness of breath, so baby has a trouble feeding, having a feeding, because it is difficult to feed a baby which has a cyanosis or blue baby syndrome. So if we look at the causes of blue baby syndrome, so there are multiple causes, but first of all we have to look at the structure, anatomy and physiology of human heart. As you know that our heart is composed of four chambers: right atrium, left atrium, right ventricle, left ventricle. So I'm going to describe briefly the circulation mechanism of the human heart. The deoxygenated blood from inferior vena cava and superior vena cava comes into right atrium. From right atrium, deoxygenated blood moves to right ventricle. From right ventricle, deoxygenated blood, which is in blue color, is going to pass through pulmonary trunk and into pulmonary arteries, which takes blood, deoxygenated blood, to lungs for oxygenation. After oxygenation, oxygenated blood brings back to heart through pulmonary veins into left atrium. From left atrium, blood goes into left ventricle, and from left ventricle, blood goes into aorta to supply this oxygenated blood to whole body. So what are the problem? Where is the problem which is causing cyanosis? So number one problem is atrial septal defect. This is atrium, right atrium, this is left atrium. These two atria are separated by a wall. So there is a hole left during the process of development inside the baby, which leads towards cyanosis, because oxygenated and deoxygenated blood are mixing up in through this hole, and that is the major cause of blue babies. The second cause is ventricular septal defect. Look at the structure of heart. This is right ventricle, this is left ventricle. Both these ventricles are separated by a septum, which is known as interventricular septum. During the development process, this there is a hole, there is a gap left between these two ventricles. So what is going to happen? This ventricle contain, right ventricle contain deoxygenated blood, left ventricle contain oxygenated blood. During circulation, these two bloods are going to mixed up, and mixed blood is going to be supplied to the baby as tissues or muscles, which is going to cause cyanosis. There is another condition of heart which can lead to cyanosis, that is patent ductus arteriosus. So if you look at the structure of heart, this is pulmonary trunk, which is going towards to convert it into pulmonary arteries, which are going towards lungs for oxygenation, and this is duct which is known as aorta. Aorta is a duct which carry oxygenated blood to all parts of the body. So what is patent ductus arteriosus? When aorta descends down, it can aorta and pulmonary artery, they are joined together through a duct, which is small kind of connection between these two arteries. So that is why it is known as patent ductus arteriosus. Now what is going to happen? Deoxygenated blood in the pulmonary artery and oxygenated blood in the aorta is going to mixed up, and the result In result will be the poor oxygenated blood, which is going to supply to the body of the fetus, and it is going to cause cyanosis. Respiratory distress syndrome is a condition of lungs in which in the alveoli of the lungs there is a deficiency of surfactant, which is a chemical substance produced during the process of development to prevent the collapsing of the lungs. And due to some problems, there is not enough surfactant in the lungs, so lungs tend to collapse, and there is poor respiratory system, poor working of respiratory system, and that is why there is a poor oxygenation of the blood. That is also a major cause of blue baby syndrome. Other name of the blue baby syndrome is methemoglobinemia. Methemoglobinemia is a kind of anemia. In this condition, there is a this substance present in the blood which causes poor oxygenation of the blood or poor release of the oxygen from the blood, which is also known as blue baby syndrome. This is usually caused by a high amount of nitrates in the water which is coming from the well. Sometime gets in, these nitrates can penetrate into the food and into the body and cause this cyanosis of the body and defects in the heart, which can lead to blue baby syndrome. So if we look at the treatment of blue baby syndrome, so the first of all, and the doctor has to take some tests like X-ray, ECG, and some blood tests to diagnose that what is the real cause of the blue baby syndrome. So once the real cause has been determined, then doctors go toward the treatment. The first of all is treatment. If it is related to the heart, it is a surgery. If the hole is present, if the gap is present between the ventricles of the heart, then this is going to be closed with the help of surgery. If the gap is between both atria, this gap is going to be closed by the surgery. If it is a patent ductus arteriosus, which is going to be closed and treated with the help of surgery, and the condition will be okay. Certain medication can also be used, including blood transfusion to remove the deficiency of the oxygen in the body. One of the medication is methylene blue, which is administered through veins with help of a needle. This methylene blue is going to increase the oxygenation of the blood, this methylene blue is only given under certain conditions in strict environment of a emergency in the hospital. So that's all for today. See you in the next lecture.